Okay, you are at Resiliency Champions. So, as I said, welcome and happy Friday. We are going to just do a brief check-in because it's a good way to start just by taking a deep breath and kind of clearing your minds for just the next 30 minutes or so and thinking about how to build your resiliency and how to grow stronger, both for yourself and along with those around you. So, quick check in. Last week, or 2 weeks ago, last session, we talked about ways to go underneath the surface. So, a lot of times when we're working through our feelings, we have sort of like a top line feeling, and it falls within the range of like mad, sad, happy, glad, depressed, frustrated, some really common words that we use over and over and over again. But there's actually thousands of words that describe feelings. And I shared with you a handout that kind of gave you a way to expand your communication strategies around feelings. And there was a list of positive feelings, a list of negative feelings. If you missed out on this, just let Kaylee know in the chat and she would be happy to send this handout to you. I think it's really good and it crosses all ages and generations. And the basic premise is that we kind of start with a top line feeling. So I felt bad when, and then something happened typically, and this will be pertinent to something we talk about a little bit later. I feel bad when, this action happened or this event happened. But what I was really feeling was, and then going deeper into what that might be, I was really feeling, frightened, or I was really feeling puzzled, or I was really feeling humiliated. Just going to words that are more descriptive of where you really are. And so my challenge to you today is to put in the chat 3 feeling words. You don't have to write out the whole I felt, whatever, when, and what I really felt was. That's kind of the standard format for helping to trigger us to go deeper. But what I want to challenge you to do is just to think for a moment about how you're feeling, go a little bit deeper. It might be, I feel good. And, because it's Friday and I have, 4 tours set up already today. And then thinking, but what I'm really feeling is, and going further into those words, it could be like lighthearted. I'm really feeling calm. I'm really feeling grateful. So take a moment and think about what's the top line of where you're feeling, and then go down to 3 more words and just pop 2 or 3 of them in the chat all together. Words that you're comfortable sharing that go beyond sort of our standard feeling words. So take a few moments to do that. And it can be a team effort if there are multiple of you in there, so everyone can come up with a word. Who is the brave soul who's going to start? All right, thank you. Diane and Kim and Chris and Charlotte and Lindsay. Chris Clark and Chris Miller, Laura, Michelle. All right. Oh, great, Kat. Thank you, Faith. And I think one of the things that makes this really powerful is that it works for both positive feelings and emotions as well as more negative feelings or emotions. So try to get in a habit of looking at what's underneath where you are each day. And you can actually sort of assess different points throughout the day. But the more you can expand your vocabulary to describe the feelings that you're experiencing, the more powerful it is in figuring out how to, celebrate the positive feelings, obviously, but also embrace the negative feelings. They're part of life. There is no shame in negative feelings. And I think that's sometimes where all of this starts with resiliency and even mental health, mental fitness, is that, we're happy to talk about the positive feelings, but we're a little bit reluctant perhaps to share feelings that we would view as more negative or that would just put us in a more vulnerable position. So thank you for taking that risk today as we get started. And that could be something you want to commit to coming out of this session, is just really honing in more on deeper, more descriptive words that go along with your feelings. So there's no shame, no blame in what we do as resiliency champions. We have the desire and willingness, and we just come together to engage, collaborate, and multiply. So our opportunity today, we're focusing on depression and sadness. I think that within the time frame that we have, it's hard to probably get to everything that you might wonder about depression and even sadness. And so you are welcome to message in the chat if there are things that you want to know beyond what we covered today and beyond what's in your handout. And I can, look for ways to work that in to our sequences. As I mentioned last week, May is Mental Health Awareness Month. So this is a really great month for us to be focused on areas that have to do with mental health. And so today we'll focus on difference between sadness and depression. That'll be pretty brief. Understanding the symptoms, causes, diagnosis, and treatment of depression. So we'll go further into the depression area. And then a few strategies for managing your energy by supporting your mental health. And, what I want to say, you guys, is there is no shame in depression. The incidence is very high in the United States and across the world. And so it's absolutely imperative to find ways to work through it and get help. Don't isolate. That is one of the biggest things that I'll be talking about with depression. Is the worst thing you can do is isolate and just feel alone in your depression. So that's our opportunity today. Let's just talk briefly about sadness. This is not on your handout, but I just wanted to set the stage because sometimes we use both words. And the other thing that we do is we'll say, well, I feel really sad. I'm kind of depressed. Like, we use depressed or depression as a descriptive word describing our feelings. And then we also use it as a clinical diagnosis. So it can be really confusing because those are two very different things. So we know that we all feel sad at various points in our life. And even extreme sadness is a natural reaction. It's how we are wired as human beings. And as I mentioned, sometimes when we feel sadder than usual or just this extreme sadness, we'll say, I'm really depressed, or I feel depressed. And at that point, that's not a diagnostic term, it's a descriptive term. And those two things are very different. Sadness, as we experience it through life, can turn into depression. And that is at a clinical level. That happens when it continues to get deeper and deeper, and it persists over time, and it impacts your daily functioning. So one of the big differences is, although they both involve our emotions and they both can come as emotional reactions to things that are happening, with clinical depression, it is more invasive and impactful in our lives. and can really interfere significantly with our daily functioning. And it also persists over time. And so that's one of the ways that we know when extreme sadness crosses over into clinical depression. And I'm not here today to help you become self-diagnosers of clinical depression, or even to put you in a position where you would start to think about people in your life and whether they have clinical depression. You need to see a healthcare professional in order to do that. So that can come through your primary care physician. It can come by seeing a psychologist or other therapist. It can come by seeing a psychiatrist. But please, if you have concerns, the best thing you can do is seek professional guidance. You also can get that guidance and that assistance through the EAP. So that, sadness typically comes as an emotional reaction to events or experiences in our lives. I gave some examples of things that often can trigger a deep, deep sadness, but it doesn't become depression until it crosses over and until it's clinically diagnosed. All right, so what are just some general symptoms of depression? We see changes in sleep and appetite. There can be a lack of concentration, a loss of energy, a lack of interest, a hopelessness that can come from that, low self-esteem, changes in movement, and I'll go into these a little bit more in a moment, and physical aches and pains. One of the things that we know for sure is that people with depression experience symptoms differently. Again, a reason why it's really important for a trained healthcare professional to see you to determine whether or not you have what we would reference as clinical depression. And there are different kinds of clinical depression, and those are identified in the handout that I provided with you. Our time doesn't really permit me to go into that this week. I can do that a different week if there's interest. And again, let me know what you guys want. I'm more than happy to cover it. But today I just wanted to kind of give this an overarching umbrella and a landing spot that is shared across Resiliency Champions at JC Hart Company. All right. Now, what we know too is that depression has, it's one of the most common mental health challenges or illnesses in the United States. Estimates for impact go, I've seen everything all the way up to about 26% of adults. I think that's a little bit high. It is much more probably toward around like the 7%, and I think that's what's in your handout. But there's lots of ways of looking at depression, but again, what we're talking about here is the impact of clinical depression. And so you can see all the regions in your body that get impacted. So at the cognitive level, you can have trouble with memory or decisions. You can have feelings of sadness, emptiness, insomnia, so difficulty sleeping, or too much sleeping. Preoccupation with death can come along with depression, and feelings of clinginess, just interfering with daily activities, risk of heart attack, weight fluctuations, constricted blood vessels, increased pain sensitivity, fatigue, impact on sexual drive and desire, and also weakened immune system. So depression is not something to ignore or to say, well, it's not possible that I have depression, or, depression is a sign of weakness. It's not any of those things. And it can be very detrimental to us physically. And that happens when we persist in a state of depression without getting any kind of assistance or therapy or treatment. So I am putting this up in front of you guys, especially to call your attention to the fact that it's not just a mindset. It's not just a feeling. It's something that we experience physiologically if we are, clinically depressed, and it can have very harmful impact on our bodies. And that hopefully stimulates really thoughts about the necessity of seeking treatment for it. Don't let it fester. There are a lot of different factors that can contribute to depression, and one of the things that is important to know that is that it just doesn't have a single cause. So it also can be triggered or it can occur spontaneously within us as human beings. So trauma at a very early age can contribute to depression. It doesn't mean that if you or someone you know experience trauma at an early age that they will become depressed. That's not. So again, it's not like if this happened, then you will have clinical depression. But that has been seen as a factor through research and studies that can contribute to later depression. Genetics can contribute. It's really interesting. There are twin studies where identical twins who were separated at birth and went to two different environments. So identical twins sharing the same genetic footprints were separated at birth, went to two different environments and grew up. And one a more positive environment, one a more traumatic or difficult environment. And that when those same sets of genetics met in a difficult environment with triggers, that mental health issues were triggered, whereas the exact same set of genetics in the other twin in an environment without those triggers never displayed mental health challenges or depression. So it tells you that genetics, just because someone in your family has struggled with depression, it doesn't mean you will, but it means that if there are certain triggers that you meet up with in life, it can trigger clinical depression for you. So it's not conclusive that will happen. It just means that you may be more susceptible to certain environmental triggers that can happen, or life circumstances, brain structure, same thing. Other medical conditions can also lead to depression, as can drug and alcohol abuse. That's kind of a chicken and an egg question generally at the clinical level. It's kind of like, were you feeling depressed and self-medicated and eventually it became an addiction or an abuse? Or were you abusing and then depression accompanied that? So again, getting with a professional to sort those things out is really critical. All right, so those are factors that contribute to depression. How is it diagnosed? I mentioned that it's really important to have it professionally diagnosed. So I am not giving you the criteria that boils down into the diagnostic statistical manual that is used by professionals, because I think that can be fairly dangerous for people. It's just really helpful to look at these things and say, if multiple of these things have been persisting for you over a period of longer than 2 weeks, then it's really important to see a professional for diagnosis. But how do we do it as professionals? Well, we look at sleep disturbances, and that can be too much or too little. We look at change in appetite or weight, and that can be weight gain, appetite increase, or appetite decrease, weight loss. Difficulty concentrating and making decisions, feeling agitated, or just feeling really slowed down. And that's beyond maybe, the norm. We all feel slowed down sometimes. We all feel agitated. But again, this persists and it's at a deeper level. Loss of interest or pleasure in kind of life, daily activities, feelings of low self-worth, guilt or shortcomings, fatigue, and potentially suicidal thoughts or intentions. So those are kind of the categories that get looked at when depression is diagnosed. And we have to look at the intensity and the length of time that those and the impact of those different diagnostic areas. And again, a major depressive episode or clinical depression impacts life. It impacts the way that you're functioning in life. It's not something that you can just keep to yourself. Others will see or experience aspects of it. What is treatment for depression? There are a lot of things out there, and some of them have, research studies that are through juried medical and psychological journals, and others are things that people are using and finding helpful. So I've kind of put a combination here. There are medications that have been found to be very effective with depression. And what the American Psychological Association advocates is a combination of medication and therapy, never just medication. So what I want you to hear there is there's no magic pill here, guys. You can't just take a pill and feel better, but the combination of medications and therapy can be very beneficial. Therapies that have been found through research studies to be beneficial include cognitive behavioral therapy, interpersonal therapy, which is also called IPT, and family focus therapy. There are brain stimulation therapies that have been found to be helpful, light therapy, and this kind of gets into the seasonal affective disorder arena, which is a topic for a different day if you guys are interested, but it can also be very helpful with depression. Exercise has absolutely been found to make an impact. It's like the last thing you feel like doing if you are struggling with depression, but it has absolutely been found to have that brain-body behavior connection and to be helpful. People use alternative therapies like acupuncture, nutrition, supplements, self-management strategies, and education can be very helpful, and that kind of ties to cognitive behavioral therapy. And then mind-body approaches, including prayer and meditation and those types of things. So I wanted to give you, and we'll send these slides out because I wanted to kind of supplement what I was giving you in the handout. But I wanted to give you 5 ways to support your mental health. And this is sort of like, staying on the other side of depression. These are not going to, absolutely prevent depression, but it can be really helpful if you have practices in place to support your mental health. Then you lessen the chance that you're going to trigger into difficulties that are at a clinical and life impacting way or life disrupting way when it comes to depression. And so this is a great list, and I want to challenge you to look at this list and to choose something off this list and jot it on the back of your handout. Or maybe you want to just take a picture of it and say, you know what, these are 5 areas that I really need to pay more attention to. So owning your feelings, we've talked about that. Finding the positive. The best way to do that, you guys, is write it down, not just like do it as a mind activity. But there are people who have really good gratitude practices. I've seen a lot of people do it on the way to work, whether you're walking to work or driving to work, just like, all right, I'm going to just come up with the things for which I'm grateful. And then on the way home from work or at night, or when you wake up and you have your cup of coffee. But if you build it into a routine so that you do it once or twice a day, it makes a difference rather than just like, oh, maybe I should think of something positive here. Connect with others. Isolation is absolutely the least healthy thing to our mental health, and that is certainly true with depression. You need to connect with someone and really avoid isolating. That's difficult to do because depression, as you guys saw, creates feelings where you want to isolate, you want to be left alone. And then eliminating toxic influences. It's really good. It's spring cleaning time. And I think of this as a time to like spring clean ourselves. And that is a great resiliency champion practice to just go like, let me just take inventory of my life and kind of where I am and who I'm involved. Think about, are there toxic people in your life or toxic habits or toxic patterns of thought? I guarantee every single one of us has something in at least one of those categories. So how do we clean that out? So when you're spring cleaning, think about how to spring clean the toxic influences so you can shove those out of your life. And then creating healthy routines. And one of the things we say all the time through Resiliency Champions is just start small, start somewhere. And so you can think about food, exercise, sleep habits, media consumption. And we've talked about some of these in other sessions. So I just wanted to kind of connect that into our conversation today. So why is all of this important? The estimate right now is that 17 million adults in the United States live with depression, and it's highest among younger people. So it's very high right now among the age group of 18 to 25. It's nearly twice the rate, actually, among 18 to 25-year-olds than it is to people who are 26 and over. So it's something to be aware of for yourself and those in your life, and it doesn't mean it doesn't occur elsewhere. I am not focusing today, obviously, on seniors or on children. I will tell you that the lists that I've given you do not apply necessarily in the same way to children. Depression looks different in children than adults. So please exercise caution there. If you want information that's more specific to children, reach out to me and I can connect you with that. It is a leading cause of disability worldwide, and so it does enter the workforce. And they estimate that fewer than half of the people who have, clinical depression or major depression even seek or receive treatment for it. So it's high incidence with low treatment. Everybody thinks if they just buck it up and we, we give ourselves and those around us messages, we can do this. But please don't think that way if you are struggling with depression or depressive symptoms. You don't need to self-diagnose, just seek help. And then the other thing I will say is that they estimate that through depression and anxiety, we lose productivity across the United States at a level of about $1 trillion a year. So depression is very relevant to the workplace. And the cost is lower than the cost of treating a lot of other conditions. And yet, there's some stigma attached to it. And one of the things I wanted to do today is to really get you thinking. Depression is all around us, both at just, a sort of sadness level where it's not depression, but where we start to feel depressed. And then even more importantly, at a clinical level or a major episode level. And there's no shame in that. So find ways to support your mental health. Depression is real. Please seek help. You can access our confidential EAP. You can talk to your primary care provider. You can seek therapy. There are sometimes, I can tell you guys at various points in my life, which generally happens on a frequent level. People ask me for referrals or how to seek therapy. What's a good way to seek therapy? I don't know if that's a Resiliency Champions topic for another time, but I'm always happy to connect with people one-on-one. I do that across my life. It's just part of who I want to be as a Resiliency Champion and as a multiplier. I also found this really powerful video, and it's 15 minutes long, so it's a little bit more of a time investment. Kaylee will put that in the chat as well. And it is, I think, just worth the watch when you have a few moments to do it, whether you're identifying with depression for yourself or someone you love or care about. It's just a really powerful video, and I think it might be really impactful for all of you. So I encourage you to look at that. So let's take a moment now as we're coming to a close. These sessions always go so fast. As Resiliency Champions, we want to start small, start somewhere. So identify one thing that you have as an intention over the next 2 weeks until we meet again. What is one thing that you can do for yourself, for someone else, and Who will you tell? We've talked before about accountability increases significantly if we share with someone else who we trust what it is we intend to do. So take good care of your mental health. Continue to work on your mental fitness. And if you are experiencing symptoms that could potentially be some level of depression, and there are different types of depression, you guys, I just couldn't go into all of them in this chat, but they are in your handout, even like seasonal affect I mentioned, but postpartum depression, that's real. Sometimes people are like, oh, is that just a mood state? No, it's real. And for those of you who have struggled with it, So just think about one thing that you can do, one intention, jot that down on the back of your handout or in your journal or whatever you use to take notes. And the other thing that I was going to connect you with, and we'll send it out as a follow-up with these slides, is there is an online assessment that you can take to see if you need to be concerned about potentially being depressed. And so I'll send you the link to that. It's not anything connected directly to JC Hart. It's connected through National Mental Health. And it's just kind of a surface way. If you're like, I feel on the fence, I'm not sure for myself or someone else, I'll get that link to you in the slide set. And you can, assess yourself and get that feedback, and then please take action. And if I can be of help to anyone at any time, feel free to reach out to me directly. And I hope that this has been beneficial to you as we move now into Mental Health Awareness Month. And my thought was that next session, I would talk about nervousness and anxiety at kind of like this overall level as well. So if there is something else related to mental health that's of interest to you, please put it in the chat. Because I really want these to be what you're interested in. Or if you want to hear about nervousness and anxiety, just throw those words in there. It's really helpful for me to have feedback from you guys. I appreciate your time. We will meet again on Friday, May 7th. And in the meantime, please have a strong day. Enjoy Founders Day. And look forward to your Dilly Bar delivery by a member of the Corporate Services Network team. Take care, you all.